Which federal statute protects peer review information from discovery in legal proceedings in many states? A. HIPAA Privacy Rule. B. Healthcare Quality Improvement Act CPHQ of 1986. C. EMTALA. D. The Stark Law. The correct answer is Healthcare Quality Improvement Act CPHQ of 1986. CPHQ provides legal immunity to peer review participants acting in good faith and establishes the National Practitioner Data Bank (NPDB). Many states also have peer review protection statutes limiting discoverability of peer review records. Which of the following best describes accountability in a healthcare quality program? A. Punishing individuals who make errors. B. Clearly defining roles, responsibilities, and consequences for performance. C. Reducing transparency in reporting. D. Eliminating peer review processes. The correct answer is clearly defining roles, responsibilities, and consequences for performance. Accountability in quality management means that individuals and teams understand their roles, are given the tools to succeed, and are held responsible for performance in a fair and transparent way. What is the primary purpose of medical peer review in a healthcare organization? A. To discipline physicians for billing errors. B. To evaluate the quality and appropriateness of care provided by medical staff members. C. To credential new medical staff applicants. D. To review nursing documentation for compliance. The correct answer is to evaluate the quality and appropriateness of care provided by medical staff members. Peer review is a process by which physicians assess the clinical performance of their colleagues to identify opportunities for improvement, address potential quality concerns, and promote accountability within the medical staff. Social determinants of health include which of the following? A. Genetic predispositions only. B. Socioeconomic status, housing, education, and access to food. C. Clinical diagnosis and lab values. D. Hospital staffing ratios. The correct answer is socioeconomic status, housing, education, and access to food. Social determinants of health are the non-medical conditions in which people live, learn, work, and play, including income, education, housing stability, food security, and neighborhood safety that profoundly affect health outcomes. Patient activation in population health management refers to A. Enrolling patients in an accountable care organization. B. The degree to which a patient has the knowledge, skills, and confidence to manage their own health and healthcare. C. Activating emergency care protocols for high-risk patients. D. Scheduling patients for proactive wellness visits. The correct answer is the degree to which a patient has the knowledge, skills, and confidence to manage their own health and healthcare. Highly activated patients measured by the Patient Activation Measure have better chronic disease control, fewer hospitalizations, and higher adherence to preventive care. Interventions that build activation are central to sustainable population health improvement. Which of the following best describes the triple fail in care transitions? A. Failure of clinical documentation, billing, and scheduling. B. Failure of communication, follow-up, and patient education. C. Failure of the patient, provider, and insurer. D. Failure of medications, equipment, and staffing. The correct answer is failure of communication, follow-up, and patient education. The triple fail in transitions of care refers to the three most common breakdowns: failure to communicate across settings, failure to ensure timely follow-up, and failure to adequately educate patients and caregivers. Ongoing professional practice evaluation (OP) is designed to A. Replace the credentialing process for new practitioners. B. Provide a continuous, data-driven review of each practitioner's performance to inform privilege renewal decisions. C. Investigate specific adverse events on a case-by-case basis. D. Audit medical records for documentation completeness only. The correct answer is provide a continuous, data-driven review of each practitioner's performance to inform privilege renewal decisions. OP uses ongoing performance data volume, outcomes, adherence to evidence-based care collected at regular intervals, typically every 612 months, to monitor each practitioner's competency and guide privilege renewal. Which of the following best describes focused professional practice evaluation? FBPE. A. Annual review of all physicians' performance data. B. A time-limited evaluation of a practitioner's competence when concerns arise or upon initial privilege granting. C. A quarterly survey of physician satisfaction. D. A retrospective audit of all surgical complications. The correct answer is a time-limited evaluation of a practitioner's competence when concerns arise or upon initial privilege granting. FBPE is a joint commission requirement, a defined, time-limited performance evaluation triggered when a practitioner is initially granted privileges or when a question arises about competence. It differs from the ongoing OP process. EMTALA Emergency Medical Treatment and Labor Act requires hospitals to A. Provide free care to all uninsured patients. B. Provide a medical screening examination and stabilizing treatment to anyone presenting to the emergency department. C. Transfer all unstabilized patients to academic medical centers. D. Report all emergency department visits to CMS within 24 hours. The correct answer is provide a medical screening examination and stabilizing treatment to anyone presenting to the emergency department. EMTALA 1986 prohibits patient dumping. It requires any hospital with an emergency department to provide a medical screening exam and stabilizing treatment to all patients regardless of insurance status or ability to pay. Which method is used to systematically evaluate the strengths and weaknesses of an organization's internal environment alongside external opportunities and threats? A. FE. B. SWOT analysis. C. Root cause analysis. D. PDSA. The correct answer is SWOT analysis. SWOT analysis strengths, weaknesses, opportunities, threats is a strategic planning tool used to assess internal capabilities and external factors when setting quality improvement priorities. The Malcolm Baldrige National Quality Award criteria for healthcare performance excellence are organized around how many core categories? A. 5, B. 6, C. 7, D. 9. The correct answer is 7. The Baldrige criteria are structured around 7 categories: leadership, strategy, customers, measurement, analysis, knowledge management, workforce, operations, and results, providing a systems view of organizational performance. Inter-rater reliability in data abstraction is best measured by A. Test reliability coefficient. B. Cronbach's alpha. C. Cohen's kappa statistic. D. Pearson correlation coefficient. The correct answer is Cohen's kappa statistic. Cohen's kappa measures agreement between two raters beyond what would be expected by chance, making it the standard method for assessing inter-rater reliability in clinical data abstraction and chart review. Which of the following is an example of a structure measure in the quality review framework developed by Avedis Donabedian? A. Patient mortality rate. B. Rate of compliance with surgical safety checklists. C. Board certification status of medical staff. D. Patient satisfaction scores. The correct answer is Board certification status of medical staff. Donabedian's framework classifies quality measures as structure, resources and conditions, process, what is done, and outcomes, results. Board certification reflects a structural input, qualifications of providers available to deliver care. Which of the following best describes a just culture in healthcare? A. A culture where all errors result in punishment. B. A culture that balances individual accountability with system-level thinking. C. A culture that ignores minor safety violations. D. A culture focused solely on financial performance. The correct answer is a culture that balances individual accountability with system-level thinking. Just culture distinguishes between human error, at-risk behavior, and reckless behavior, ensuring fair treatment of staff while still improving systems to prevent recurrence. The SBAR communication tool stands for A. Safety, behavior, action, results. B. Situation, background, assessment, recommendation. C. Standard, brief, alert, response. D. Status, background, analysis, resolution. The correct answer is situation, background, assessment, recommendation. SBAR is a structured communication framework that ensures critical clinical information is transferred completely. Situation, what is happening. Background, relevant history. Assessment, what I think the problem is. Recommendation, what I propose. Which ethical principle in healthcare most directly obligates clinicians and quality professionals to act in the patient's best interest? A. Autonomy. B. Justice. C. Beneficence. D. Non-maleficence. The correct answer is beneficence. Beneficence means actively doing good and acting in the patient's best interest. It drives evidence-based practice, continuous improvement, and advocacy for care that promotes patient welfare. Distinct from non-maleficence, do no harm. The 6 CPHQ core competencies used to evaluate physician performance include all of the following except A. Patient care. B. Medical knowledge. C. Financial management. D. Systems-based practice. The correct answer is financial management. The CPHQ 6 core competencies are patient care, medical knowledge, practice-based learning and improvement, interpersonal and communication skills, professionalism, and systems-based practice. Financial management is not one of them, though it may be incorporated into OP data informally. Utilization review conducted during a patient's active hospitalization is called A. Prospective review. B. Retrospective review. C. Concurrent review. D. Ambulatory review. The correct answer is concurrent review. Concurrent review, also called continued stay review, evaluates medical necessity and appropriate level of care while the patient is still admitted, enabling real-time discharge planning and identification of cases that can be safely transitioned to a lower level of care. Which care transition model uses a coach to empower patients and caregivers during the post-discharge period? A. Boost model. B. LACE index. C. Care Transitions Intervention CTI by Coleman. D. Interact model. The correct answer is Care Transitions Intervention CTI by Coleman. Dr. Eric Coleman's Care Transitions Intervention uses a transition coach who meets patients before discharge and follows up at home, teaching 4 pillars: medication management, patient health record, follow-up appointments, and warning signs. Which of the following best describes the HEDIS measure set? A. A set of financial reporting standards for hospitals. B. A standardized set of performance measures used by health plans to measure care quality. C. A set of Joint Commission accreditation standards. D. A Medicare billing audit framework. The correct answer is a standardized set of performance measures used by health plans to measure care quality. HEDIS Healthcare Effectiveness Data and Information Set, maintained by NCQA, is the most widely used performance measurement tool in managed care, covering preventive care, chronic disease management, and patient experience. Proctoring in medical staff credentialing refers to A. Reviewing a physician's malpractice history before granting privileges. B. Direct observation and evaluation of a practitioner's clinical performance by a qualified peer during a defined period. C. Assigning a mentor to guide a new resident. D. Conducting a structured phone reference check with former employers. The correct answer is direct observation and evaluation of a practitioner's clinical performance by a qualified peer during a defined period. Proctoring is a structured method of observing a practitioner performing specific procedures or providing care to verify competence, commonly used during FBPE when privileges are initially granted or concerns arise. The Triple AIM framework, developed by IHI, focuses on improving A. Cost, speed, and compliance. B. Patient experience, population health and per capita cost. C. Safety, staffing, and satisfaction. D. Access, equity, and revenue. The correct answer is patient experience, population health, and per capita cost. The triple aim, now expanded to the quadruple aim, guides healthcare systems to simultaneously improve patient experience, improve population health, and reduce per capita healthcare costs. A hospital's quality analyst is comparing readmission rates across 5 departments, but has different sample sizes per department. Which statistical approach is most appropriate to determine if differences are real or due to chance? A. Simply comparing raw percentages visually. B. Chi-square test or confidence interval analysis accounting for sample size. C. Calculating means and standard deviations only. D. Using a pie chart to display proportions. The correct answer is chi-square test or confidence interval analysis accounting for sample size. When comparing proportions across groups with different sample sizes, statistical tests like chi-square examining non-overlapping confidence intervals determine whether observed differences are statistically significant rather than products of random variation. A hospital's safety event reporting system shows a significant drop in near-miss reports after a disciplinary action was taken following a reported event. This is most likely due to a genuine reduction in near misses. B. Improved patient safety culture. C. Underreporting due to fear of punishment. D. Better staff training reducing errors. The correct answer is underreporting due to fear of punishment. Punitive responses to reported events undermine safety culture by discouraging future reporting. A drop in near-miss reports following disciplinary action typically signals a chilling effect on reporting, not actual safety improvement. Which type of sampling would be most appropriate when a quality team needs to ensure representation from all nursing units in a satisfaction survey? A. Convenience sampling. B. Stratified random sampling. C. Simple random sampling. D. Purposive sampling. The correct answer is stratified random sampling. Stratified random sampling divides the population into subgroups, strata in this case, nursing units, and randomly samples from each, ensuring all units are represented even if they differ in size. In a peer review case categorization system, a case classified as level Roman II typically means A. The care met the standard and no concerns were identified. B. The care may have had an opportunity for improvement but did not significantly affect outcome. C. The care definitely caused harm and requires immediate corrective action. D. The case requires external peer review due to complexity. The correct answer is the care may have had an opportunity for improvement but did not significantly affect outcome. Common peer review tiering systems classify cases as level I no issues, level Roman II potential for improvement, minor outcome impact, level Roman III definite opportunity for improvement, possibly affecting outcome, and level Roman IV significant concern, adverse outcome. Which leadership model emphasizes the leader's role in creating the conditions for others to do their best work? A. Transactional leadership. B. Autocratic leadership. C. Servant leadership. D. Laissez-faire leadership. The correct answer is servant leadership. Servant leadership prioritizes the growth and well-being of team members and the communities they serve. In healthcare quality, this model fosters psychological safety and staff engagement. Which of the following is the most appropriate follow-up action when a peer review case is classified as a level Roman IV significant care concern, adverse outcome? A. Filing the case without further action. B. Conducting a collegial discussion with the practitioner only. C. Initiating a formal performance investigation that may include privilege action and NPDB reporting. D. Requesting a voluntary self-improvement plan from the physician. The correct answer is initiating a formal performance investigation that may include privilege action and NPDB reporting. Level Roman IV findings represent serious quality concerns linked to adverse patient outcomes and require a structured formal process including a physician leader review, potential performance improvement plan, privilege action if indicated, and NPDB reporting if the action exceeds 30 days. A hospital is preparing for a joint commission survey. Which document should guide the organization's self-assessment of compliance? A. The organization's strategic plan. B. The Comprehensive Accreditation Manual for Hospitals CAM. C. CMS Claims Data Reports. D. The NQF Serious Reportable Events Framework. The correct answer is the Comprehensive Accreditation Manual for Hospitals CAM. The CAM contains all Joint Commission accreditation standards, rationales, and elements of performance for hospitals. Organizations use it to conduct internal assessments, build compliance programs, and prepare for surveys. A quality team uses a P-chart to track monthly surgical site infection proportions. They noticed the control limits widening significantly in months with small sample sizes. This is because A. The process became less stable. B. Control limits for the P-chart are inversely related to sample size. C. The baseline was incorrectly calculated. D. The infections increased due to staffing changes. The correct answer is, control limits for the P-chart are inversely related to sample size. In a P-chart, control limits are calculated as P3 P1 Pn. When sample size n decreases, the denominator shrinks, and limits widen, reflecting greater statistical uncertainty, not a change in actual process stability. How many did you get right? Let us know in the comments, and tell us what topics you want us to cover next. Want to practice more? Download the app and get hundreds of free practice questions with detailed explanations.